Have you ever wondered which carbs are the best for your kidneys? If you're dealing with kidney issues, knowing the right sources of carbohydrates is crucial for maintaining your health. According to the National Kidney Foundation, managing your diet can make a significant difference in slowing down the progression of kidney disease. They emphasize that not all carbs are created equal when it comes to kidney health. In this video, we'll uncover the top carb choices that can help protect your kidneys and improve your overall well-being. Imagine enjoying meals that not only taste great but also contribute positively to your kidney function. By the end of this video, you'll have a clear understanding of which carbs to include in your diet and why they are beneficial. Stay with us as we dive into these essential tips and practical advice. Your kidneys will thank you. So, keep watching till the end because we'll share some simple and effective ways to keep your kidneys healthy. Don't miss out on this valuable information that can make a real difference in your life. The best carb source. One of the most crucial elements of a renal diet is your choice of carbohydrates. Following the right diet is the first and most important step if you want to protect your kidneys and improve your GFR numbers. And let's be honest, you can't achieve this without the right carbs. Science clearly shows that if you have CKD stage 3 or higher, carbs must be your main energy source. According to a study published in the Journal of Renal Nutrition in 2019, a diet rich in complex carbs is associated with a lower risk of chronic kidney disease progression. Today's video is going to be particularly important for those of you on a low-protein diet, which means you'll need to eat more carbs, and also for those dealing with diabetes. If you have both diabetes and kidney disease, choosing the wrong carbs just won't cut it. So, complex carbohydrates, found in whole grains, vegetables, and legumes, are the best options. Moreover, the fiber content in these foods helps to reduce blood pressure and cholesterol levels, both of which are crucial for kidney health. While many, if not all, of these carb sources are essential in a renal diet, only one will come out on top as the best for kidney disease patients. Let's find out which one it is together. Carbs from fruit. Did you know that the carbohydrates found in fruit can be incredibly beneficial for your kidneys? Whether you have diabetes or not, let's break this down together and find the best carb source, starting with fruit. I'll tell you right away, fruit is incredibly close to being the perfect carb source. For some people, it's the best option. There are numerous cases in medical literature of people reversing the decline in kidney function with diets rich in fruit. A study published in the Clinical Journal of the American Society of Nephrology in 2020 highlighted that diets rich in fruits are linked to a reduced risk of chronic kidney disease progression. Why is fruit so beneficial? First, fruits are packed with fiber, which is a special type of carb. Plus, they're almost protein-free. But that's not all. Many fruits have unparalleled health benefits. Take berries, for instance. They are fantastic, and I often recommend blueberries because they're a true superfood. They're loaded with essential nutrients and antioxidants. Antioxidants are crucial for protecting your kidneys. They combat oxidative stress and inflammation, which are linked to many chronic diseases, including CKD and diabetes. Citrus fruits are another excellent example. While most people consume oranges and tangerines for their vitamin C, did you know their main benefit is their ability to fight diabetes? Yes, really. Some diabetes patients are surprised when I tell them this. Despite what some extreme diets suggest, there's strong scientific evidence linking the consumption of oranges and other citrus fruits to improved glycemic control and insulin resistance. This is due to a flavonoid called naringenin, which has a more powerful effect on your blood sugar levels than the small amount of sugar these fruits contain. Most fruits are low in calories and protein but rich in fiber, antioxidants, vitamins, and essential minerals. So, do we have a winner? Well, not quite yet. While fruit is fantastic, especially if you have diabetes, you shouldn't rely too heavily on it. The key is moderation. So, while fruit is a top contender, it's not our winner today. Let's keep exploring to find the best carb source for your renal diet. Let's talk about carbs from whole grains. Whole grains like bulgur, wild rice, and barley? They're not just healthy, they're like little superheroes for your body. Take bulgur, for example. It's like this secret weapon against insulin spikes, especially great if you're trying to keep your blood sugar in check. And guess what? The reason these whole grains are so good at keeping things steady is because of their fiber content. Fiber? It's like a magic potion for your insides. It buddies up with your kidneys, helps your gut microbiome flourish, and even gives those nasty toxins the boot faster. Plus, it slows down digestion, which is a lifesaver for managing blood sugar levels, especially if you're dealing with diabetes. But wait, there's more. Let's zoom in on bulgur again. Not only is it a fiber powerhouse, but it's also loaded with B vitamins, magnesium, iron, and manganese. Talk about a nutritional jackpot, especially for folks with CKD. And then there's rolled oats. These little guys are packed with beta-glucan, a kind of soluble fiber that's like a detox ninja. It swoops in, cleans up your system, and even helps with keeping glucose and cholesterol in check. How? Well, beta-glucan turns into this gel-like superhero in your gut, sweeping away toxins like nobody's business. Now, I've got to give a shout out to wild rice. It's like the unsung hero of whole grains. It's got all the benefits of oats and bulgur, plus a bonus, it's lower in phosphorus. And when you're dealing with kidney issues, watching your phosphorus intake is crucial. But hey, let's not forget, all whole grains still pack a bit of phosphorus punch. And too much phosphorus? Not great when you're trying to stick to a renal diet. So here's the scoop, while whole grains are amazing and all, they might not be the best bet if you're trying to dial down your protein intake. And for a lot of folks with kidney problems, cutting back on protein is key. So, as much as we love our whole grains, they might not be the golden ticket for everyone dealing with CKD. It's all about finding the right balance. Let's talk about a carb source tailor-made to help folks with CKD cut down on protein and phosphorus. You might be wondering, why bother with carbs at all? Aren't they the bad guys behind diabetes? Well, not quite. When it comes to kidney issues, avoiding carbs altogether isn't the way to go. If dodging dialysis is your game plan, then carbs need to be your best buddies. Sure, you could load up on steak if you're cool with dialysis becoming a regular thing, but let's aim higher, shall we? If your priority is feeling good and staying free from health hiccups, then listen up. Carbs need to be your main squeeze, according to science. Like, 60% of your energy intake needs to come from these carb-rich goodies we're chatting about today. That means waving goodbye to protein-packed pals like meat, dairy, and fish. Now, about diabetes, here's the scoop. Type 2 diabetes? It's got a chance at hitting reverse, but not if your diet's all about the red meat express. According to some top-notch studies published in BMJ, the real key to unlocking the diabetes puzzle isn't carb crimping, it's calorie control. Wrap your head around this, 200 calories of grapes versus 200 calories of bacon. Guess what? It's not about the carbs, it's about the calories. Which one's gonna keep you feeling satisfied? Spoiler alert, it's the grapes. So, if shedding those extra pounds is on your to-do list, and it probably should be for diabetes management, loading up on grapes beats nibbling on bacon any day. Now, let's dive into something even more exciting: aproteic food items. Picture this: pasta, bread, and rice that are protein-free. Yep, you heard that right. These goodies are specially crafted to be gentle on your kidneys, especially if you're playing the protein watch game. You know, a lot of folks think they're in the clear just by steering clear of the usual suspects like meat, fish, and eggs. But surprise, surprise, turns out, many still end up with more protein on their plate than they bargained for. Even with a diligent eye on their diet, most CKD patients tend to overshoot their protein targets. And here's the kicker: it's often because the carb sources they're munching on are sneaky protein carriers. Take bulgur, for example. It packs a protein punch of 12 grams per 100 grams of dry product. Wild rice, 7 grams. Even bread slides in with almost 3 grams per slice. Now, if your daily protein goal is as low as 25 grams, that's a tightrope walk you probably didn't sign up for. But fear not, aproteic food items are here to save the day. Not only are they protein-free, but they also give phosphorus the cold shoulder. Plus, they're often loaded with the vitamins your body craves, like B12, B9, and D. It's like hitting the nutritional jackpot, right? Well, not quite. Here's the plot twist: while they might be a game changer for someone battling stage 4 CKD sans diabetes, if you're juggling diabetes in the mix, things get a tad complicated. See, aproteic pasta, bread, and rice? They're what we call processed carbs. Dive into them too enthusiastically, and you might find yourself on a blood sugar roller coaster. Now, don't get me wrong, a moderate serving with some veggies and healthy fats can help smooth out the ride. But for some diabetes patients, the thought of processed carbs is a hard pass. So, let's talk about the absolute gems of carb sources: starchy veggies like potatoes, beets, and squashes. Not only are they bursting with fiber, which is like a secret weapon for your kidneys, but they also bring a whole bunch of other health perks to the table. Take beets, for example. These colorful wonders are loaded with nitrates, powerful little helpers that widen your blood vessels and might even give your blood pressure a gentle nudge downwards. Talk about a veggie you don't want to skip. Now, let's give some love to red potatoes. They're not just your average spud, they're packed with goodness. Nutrients? Check. Fiber? Double check. And the best part? They're gluten-free and play nice with your blood sugar levels, especially if you cook them up just right. And hey, if you're keeping an eye on that glycemic index, opt for the red ones. They're a bit friendlier for the diabetes crew. And then there's turnips. These unsung heroes are like warriors against inflammation, which is a big deal when you're rocking a renal diet. They're chock full of anti-inflammatory compounds that your body will thank you for. Plus, they're a fiber fiesta and come with a side of vitamin C, B6, and manganese. What's not to love? But wait, there's more. Carrots are another MVP in the starchy veggie lineup. They're not just crunchy snacks, they're packed with fiber and beta-carotene, the superhero form of vitamin A+. Studies say they might even help your kidneys filter out toxins and keep those pesky urinary tract infections at bay. So, bottom line? Starchy veggies are the real MVPs when it comes to a renal diet. Sure, the other foods we've talked about today aren't slouches either, but if you want to give your kidneys, load up on these veggie superstars. And that's a wrap on our journey to find the ultimate carb source for kidney health. But before we go, I want to hear from you. What's your go-to carb choice when it comes to taking care of your kidneys? Share your experience in the comments below and let's build a supportive community for everyone facing kidney challenges. Your story could inspire someone else on their own journey to better health. Thanks for tuning in, and remember, together, we've got this. Kidney disease stage 5 avoided dialysis. Just do this. Have you ever wondered how you can avoid the pain and hardship of kidney dialysis? Well, what's the alternative? If so, you're not alone. According to a recent report by the World Health Organization, millions of people are at risk of kidney failure, but the good news is, there are effective ways to prevent it. But what if there were not just one, but 5 alternatives to dialysis for people with stage? In this video, we're going to share with you 5 proven solutions to keep your kidneys healthy and avoid the need for dialysis. Some of these have been shown to give to stage 5 patients up to 4 years without dialysis. Imagine a life where you don't have to worry about kidney health. By following these simple tips, you can significantly reduce your risk of kidney disease and enjoy a healthier, more active life. We'll cover everything from diet and hydration to lifestyle changes and regular checkups, providing you with actionable advice that really makes a difference. Stay with us till the end of this video, and you'll learn how easy it can be to take control of your kidney health. You'll discover practical steps that you can start implementing today to ensure your kidneys stay in top shape. So, don't miss out. Watch till the end and empower yourself with the knowledge to protect your kidneys for life. Maximal Conservative Management, MCM. Maximal Conservative Management, MCM, or non-dialytic care. Let me tell you about 77-year-old Mrs. Smith, who decided to go with Maximal Conservative Management, MCM, also known as non-dialytic care, for her chronic kidney disease. Mrs. Smith has had her share of health battles. She has heart disease and underwent bypass surgery. Her kidney disease diagnosis came 10 years ago, and in 2016, she was supposed to start dialysis as her condition worsened. However, she chose a different path. Her daughter shared, "It's been a year since my mom started conservative management, and her condition is still stable." If she had chosen hemodialysis, it would have meant another surgery to ease the strain on her heart, which her aging body just couldn't handle. Choosing non-dialytic care is more common than you might think. Today, there are clinics that specialize in this therapy. So, what exactly does maximal conservative management involve? Typically, conservative management is for patients with a shorter life expectancy, but that's not always the case. The main goal is to manage health issues caused by kidney failure, such as anemia, and symptoms like nausea and fatigue, while preserving kidney function as long as possible. The treatment often includes diuretics and antihypertensive medications. A decade ago, this might have seemed like a bleak choice, but some doctors have managed to provide their patients with years free from dialysis, enjoying a good quality of life. Activated charcoal. Let me share with you a remarkable home remedy that's proven to be a powerful detoxifier, especially for stage 5 CKD patients. This remedy is none other than activated charcoal. Activated charcoal has gained popularity as a detoxifier. People use it in small doses for everyday issues like bloating, gas, and diarrhea. It's even used for whitening teeth. In emergency rooms, doctors rely on it to treat overdoses and poisoning. Its magic lies in its ability to bind to toxins in the digestive system and remove them. But here's the incredible part. A study involved 9 stage 5 CKD patients who chose not to start dialysis. Instead, they were treated with 30 grams of activated charcoal daily along with non-dialytic care for 10 months. The results were astounding. Their kidney function didn't just stabilize, it improved. All patients saw significant decreases in blood urea and creatinine levels. This study, published in a respected peer-reviewed journal, gives me immense hope. So, what makes activated charcoal so effective for kidney health? This fine, black powder excels at removing uremic toxins, urea-derived toxins, and phosphorus. Uremia, an excess of uremic toxins, causes many symptoms in stage 4 and 5 kidney disease, like itching, swelling, trouble breathing, and nausea. By helping to eliminate these toxins, activated charcoal can significantly relieve the kidney's burden. Several animal studies support that activated charcoal can reduce serum phosphorus, urea, and creatinine levels safely with few side effects. It's even shown promise in stage 3 and 4 CKD patients with hyperphosphatemia, lowering phosphorus levels when taken with food. In short, activated charcoal is incredibly powerful at removing excess uremic toxins and could be a game changer for kidney health. Very low protein diet. The best way to protect your kidneys and avoid dialysis is to prevent those toxins from entering your body in the first place. How can you do this? Through a very low protein diet, VLPD. The VLPD is often used for treating advanced stage, pre-dialysis kidney disease, but it's especially beneficial for those who want to avoid dialysis completely. This diet was a crucial part of the treatment for the 9 stage 5 CKD patients who lived for 10 months without dialysis, thanks to activated charcoal. One major advantage of the VLPD over other treatments is its extensive use. Unlike some newer treatments, the VLPD has been tried and tested on thousands of CKD patients. Although it's not very common in many parts of the world, including the US, it's showing impressive results where it is used, such as in Italy. In fact, I've met people who have maintained stage 4 kidney function for 20 years without significant deterioration, which is remarkable. I'm not the only one who believes in the effectiveness of the VLPD. A large review of studies involving 2,996 people concluded that very low protein diets reduced the number of people with CKD stage 4 or 5 who progressed to end-stage kidney disease. This means that nearly 3,000 people following the VLPD had a lower chance of needing dialysis. The concept behind the VLPD is straightforward: the kidneys are damaged by protein. By drastically reducing protein intake, kidney function can improve. While this sounds simple on paper, it's not something you can do on your own. A very low protein diet requires precise calculations and special supplementation. I've created a whole video on this topic, which you can watch if you're interested. Also, I'd love to hear from those of you already following any kind of low protein diet, whether vegan, plant-based, or otherwise. Let me know if you'd be interested in a video about what works and what doesn't in these diets. I'm planning to make more content on low-protein diets and want to know how much interest there is. Now, let me tell you about another detoxifier that's even more powerful than activated charcoal. Gum arabic. Also known as the gum from the acacia tree, is a soluble dietary fiber that works like a brush in the intestine, removing waste and toxins. You might find it in everyday products, from candies to cosmetics. As a remedy, studies suggest it can help with diabetes, high cholesterol, weight loss, and high blood pressure. Here's the truly fascinating part. Gum arabic has been used to avoid dialysis entirely for an 11-year-old girl with almost no kidney function. According to a study, she lived 4 years free from dialysis, enjoyed good health, participated in outdoor activities, and never experienced acidosis or significant uremic symptoms. This makes gum arabic the most powerful kidney detoxifier known. The girl was also treated with other therapies to support her kidney function, including the VLPD we talked about earlier. While gum arabic is a readily available and affordable home remedy, it's not yet an approved treatment for stage 5 kidney disease. However, its remarkable success has spurred more research. A recent study, published in the Journal of Functional Foods just last week, investigated gum arabic's kidney protecting properties in stage 3 and 4 CKD patients. These patients had their normal diets supplemented with 25 grams of gum arabic daily for 12 months. The results were astounding. Typically, a patient's GFR, a measure of kidney function, is expected to decline slowly in these stages. Instead, the GFR of patients in this study increased within just 3 months. Even more amazing, a year after the treatment ended, their GFR continued to rise. Researchers believe these effects are due to gum arabic's anti-inflammatory and antioxidant properties. While more research is needed before this becomes an approved treatment, these findings are incredibly promising. If you think this is good news, it's time to spread the word. Share this information with anyone you know who suffers from kidney problems or whose loved ones do. Awareness is key to making these affordable and effective treatments available to all kidney patients worldwide. Stay tuned, because before we dive into the number 1 treatment that could completely replace dialysis, I have some thoughts on the whole dialysis versus no dialysis debate. My thoughts on the dialysis debate. Many doctors see dialysis as the go-to response to kidney failure, believing that prolonging life is the top priority. For some, especially those over 75 with additional medical problems like heart disease, dialysis may not offer a survival benefit and can often worsen their quality of life. European studies have shown that elderly patients on dialysis only lived about a year longer than those who didn't, but most of that extra time was spent in hospitals, traveling for treatments, or undergoing dialysis. That's why some doctors advocate for alternative treatments. If you're looking to avoid dialysis, finding a doctor knowledgeable about these alternatives is crucial. Unfortunately, patients often feel they have no choice but to follow their doctor's recommendations. If your doctor insists that dialysis is the only way, you might need to seek a second opinion from a doctor who supports alternative therapies. There are clinics and doctors out there who believe in and can administer these alternative treatments. One widely accepted alternative in the U.S. today is the paired kidney exchange program, a lesser-known but effective way to receive a kidney transplant quickly. Understanding your options is essential, and it's important to find a healthcare provider who supports and guides you through the choices that best suit your health and lifestyle. The Paired Kidney Exchange Program. Let me tell you about the Paired Kidney Exchange Program, a wonderful way to find a compatible kidney donor when a direct match isn't possible. Imagine you need a kidney, and you're fortunate enough to have a willing donor, a relative, spouse, or friend. However, compatibility is crucial. The donor must have a compatible blood type and pass tissue typing tests to ensure the match is suitable. If either test fails, a direct donation isn't possible, which can be disheartening. This is where the Paired Kidney Exchange Program comes in. If you and your donor aren't compatible, you can join the program and be paired with another incompatible donor/recipient pair. Essentially, your donor will give their kidney to a recipient in the other pair, while you receive a kidney from that recipient's donor. This swap can involve multiple pairs, creating a chain of donations that helps several people at once. If you're interested in this program, contact your transplant hospital or a transplant hospital that offers an exchange program. They can provide the guidance and support you need to navigate this life-changing opportunity. Thank you for watching our video on. We hope you found these options helpful and inspiring. Have you or a loved one tried any alternative treatments for kidney disease? Share your experiences in the comments below. Your story could make a big difference to someone in our community. Don't forget to like this video, subscribe to our channel for more content, and hit the notification bell to stay updated. Keep taking good care of your kidneys and be good to yourself. This is all for today. Thank you for watching. Kidney disease can be reversed, in any stage, taking this vitamin. Have you ever wondered if your kidneys are as healthy as they could be? What if we told you that chronic kidney disease, CKD, could be silently affecting your life right now? According to the World Health Organization, nearly 10% of the global population is suffering from CKD, often without even knowing it. Each year, 786,000 Americans end up tied to a machine for life because of kidney failure. That's millions of people at risk of severe health issues, but there's good news: knowledge and early action can make all the difference. Now, CKD is not a life sentence anymore. Your condition can be treated by managing a single mineral. With the use of a combination of natural supplements, you are actually able not just to avoid dialysis, but to go back to stage 2. And what stage 2 CKD means is not just not having to undergo dialysis, it means not having to follow a renal diet anymore. It means not having to do any therapy at all for kidney disease. Imagine feeling more energetic, living without the constant worry about your kidney health, and taking simple steps that could drastically improve your quality of life. This video is here to help you achieve just that. We'll share practical, science-backed tips and tricks that can help you manage and potentially reverse the effects of CKD. Stay with us until the end of this video, and we'll reveal straightforward strategies to keep your kidneys healthy and robust. Don't miss out on this essential information. Your health could depend on it. Let's dive in and take control of our kidney health together. Now, guys, what we are looking at today is no work of fiction. This is a study. This was published as part of an article in a peer-reviewed medical journal. Reversing chronic kidney disease with niacin and sodium bicarbonate. This is the title of this article. As we will see, this is the story of an 81-year-old man who was diagnosed with CKD only when he was in late stage 4 already. Because even if he had received a quintuple bypass and even if he was suffering from prediabetes and high cholesterol levels, no doctor ever thought about checking his kidney function, not until symptoms of kidney failure started to show up. But that's usually way too late already. Well, not in this case. Because you see, this man was able to find a therapy that worked. So, what was his secret? Could it really be as simple as controlling serum phosphorus levels? His approach involved diligently taking supplements aimed at aggressively managing his serum phosphorus levels. But hold on a second. You might be wondering, can merely controlling serum phosphorus levels be sufficient to completely reverse CKD? Well, in certain cases, it absolutely can. Here's the thing about chronic kidney disease: it's not a one-size-fits-all condition. It's more like an umbrella term covering a range of kidney issues, each with its own causes and potential treatments. However, there's one common denominator among all CKD patients: phosphorus. Let me emphasize this point, it's crucial. Lowering phosphorus levels could be the key to halting the progression of the disease. Excess phosphorus isn't just harmful to your kidneys, it wreaks havoc on virtually every organ system in your body. So, if you're dealing with CKD, getting those phosphorus levels down is non-negotiable if you want to see any improvement. Today, I want to shed light on the most effective strategy for managing phosphorus levels, a factor often overlooked but capable of making a world of difference for CKD patients. It could mean the distinction between ending up on dialysis or regaining control and returning to stage 2. For this patient, tackling phosphorus alone was the ticket to restoring his creatinine levels and kidney function to normal. And guess what? You can do the same. Stick around because we're about to uncover how. If you find this video helpful, please hit the like button and consider sharing it with a friend. And I know what you might be thinking, I'm already juggling concerns about potassium, oxalate, and uric acid. Do I really need to add phosphorus to the mix? Trust me, it's worth paying attention to. Phosphorus is one of the most critical renal toxins, and it doesn't just harm your kidneys, it can be deadly. Recent studies are increasingly linking higher serum phosphate levels to increased mortality rates in people with CKD. Here's why. When your kidneys can't filter phosphorus efficiently, it binds to calcium, leading to vascular calcification. This calcification can cause heart disease, heart attacks, strokes, and more. That's why I believe high serum phosphate levels are potentially even more dangerous than high potassium levels. Phosphorus is a major reason why people with kidney disease are advised to avoid dairy products, meat, and fish. If you have CKD and still include protein in your diet, it's likely from low phosphorus sources like egg whites or beans. Controlling phosphorus levels was crucial in the case study we discussed for significantly improving kidney function. The patient would never have been able to return to stage 2 without managing his phosphorus levels. For anyone with CKD, your diet and treatment plan should prioritize controlling phosphorus levels. It's that important. So, you might be wondering, how did this 81-year-old patient manage to get back to stage 2 CKD? His remarkable improvement came from a three-pronged approach to controlling his phosphorus levels. A key part of his treatment was taking calcium carbonate, which I often recommend because it's effective. He took between 2 to 4 grams of calcium carbonate daily, along with TAID tablets during meals. Additionally, he took 1.8 grams of sodium bicarbonate per day, which is crucial for combating metabolic acidosis, a common issue in CKD patients. Another important component of his treatment was niacin. While niacin isn't typically used to manage phosphorus levels, it has shown potential benefits in this area. The author of the study believes that niacin played a significant role in the patient's recovery to stage 2 CKD. Niacin not only helps lower phosphorus levels but also combats proteinuria. Interestingly, the way niacin was administered in this study differs from the typical approach for kidney disease patients. We'll dive deeper into the specifics of niacin treatment in the next part of this video. Before we move on, let's talk about something crucial. Are your phosphate levels under control? It's crystal clear that without a solid strategy to manage phosphorus levels, you can't effectively handle CKD or prevent kidney failure. So, is your approach to controlling phosphorus working? This is critical because, as we've seen, it can literally save your life. The only way to know if your phosphorus levels are in the safe range is by checking your recent blood work. The ideal range for phosphate is 2.5 to 4.5 milligrams per deciliter. If your levels are higher than that, you're at significant risk of rapid kidney disease progression. So, what can you do if your phosphate levels are out of range? There are two main ways to lower phosphate levels: limiting your intake through diet and using binders. Let's start with diet because it's probably the most important step to improving your kidney function. The big question is, which foods contain phosphorus? The most common dietary sources of phosphorus include dairy products, meat, poultry, and seafood. Processed foods such as deli meats, bacon, sausage, sodas, and sports drinks are also high in phosphorus because phosphates are often used as food preservatives. Additionally, baked goods, breakfast cereals, sauces, and many other packaged foods can be rich in phosphates. If your goal is to reverse kidney disease, all the foods listed here should be completely avoided as they're not suitable for a renal diet. However, there are some foods with phosphorus that you don't need to completely eliminate. These include legumes, nuts, whole wheat breads and cereals, and certain vegetables like asparagus, tomatoes, and cauliflower. So, there are foods with phosphorus you should avoid entirely and others you can still enjoy. But why is that? Why is phosphorus from some foods worse than from others? The answer lies in the type of phosphorus and how our bodies absorb it. Stay tuned, and I'll explain this in more detail. There are various types of dietary phosphorus, and this distinction is important because the body reacts differently depending on the source: plant-based foods, animal-based foods, or additives. Phosphorus additives are particularly problematic. Foods with added phosphorus cause your blood phosphorus levels to rise more than foods with natural phosphorus. This is because phosphorus from additives is nearly 100% absorbed by the body. Phosphorus from meat and dairy is also highly absorbed, with about 90% ending up in our bodies. In contrast, only about 30 to 40% of the phosphorus from plant-based foods is absorbed. Additionally, plant-based foods contain much less phosphorus than animal-based foods, making legumes, nuts, seeds, and grains suitable for your diet despite their phosphorus content, due to their numerous health benefits. So, if you've followed along, you now understand why a plant-based diet, primarily consisting of whole, single-ingredient foods, is the cornerstone of CKD therapy. Phosphorus damages your kidneys. Therefore, the first rule of a renal diet is to avoid meat, fish, dairy, and processed foods with added phosphorus. Always check labels for phosphates. On the other hand, strictly limiting foods like grains, nuts, seeds, and other plant-based items won't significantly help manage phosphorus levels. One more important tip: you can further reduce phosphorus absorption with a phosphate binder. So, here's a question: what can you use to decrease phosphorus absorption? Stay tuned to find out. To reduce phosphorus absorption, calcium-based phosphate binders are commonly prescribed to help lower phosphate levels. Taking them with meals can be beneficial because calcium carbonate attaches to the phosphorus in the foods you consume. This binding process allows the phosphorus to be excreted through the bowel, preventing your body from absorbing excess phosphorus. If you're not already taking a phosphate binder, it's worth discussing with your doctor to see if it's appropriate for you. These binders offer additional benefits as well. Because they're calcium-based, they can help raise serum calcium levels, which are often too low in individuals with CKD. Furthermore, calcium-based phosphate binders can protect against oxalates. In the case study of the 81-year-old patient who transitioned from stage 4 to stage 2 CKD simply by lowering his phosphorus levels, he was prescribed 2 to 4 grams of fast-acting tablets daily, taken with his main meals. While this is a common prescription, it may not be suitable for everyone. It's essential to have a conversation with your doctor about whether this treatment is right for you. Remember, phosphate binders are not unconventional supplements or alternative medicine. They are widely used in CKD patients and are recommended by current medical guidelines. If your doctor advises against using a phosphate binder for your CKD, don't hesitate to ask for clarification. Request detailed explanations for their decision. Your health is important, and it's vital to advocate for the most appropriate treatment plan for your condition. Now guys, as I was saying, the most important part of the 81-year-old patient's treatment was the vitamin, immediate-release niacin, a natural form of vitamin B3. Now, vitamins are not widely used to treat high phosphorus levels in CKD patients today, but this may change. Now, let's see why. I have personally observed more than 25 documented cases of individuals having their disease progression not only halted but reversed with the addition of 3 to 5 cents worth of niacin per day. This is what the author of this study says about niacin and CKD. But are they right? Do you actually need to take niacin in order to reverse CKD? Absolutely, individuals with CKD are indeed advised to supplement niacin, but in moderate doses. Nowadays, CKD patients are typically recommended to take all the B-group vitamins. Niacin, in particular, holds significant potential, especially for those grappling with high cholesterol levels, as it can effectively lower LDL cholesterol, commonly known as the bad cholesterol. However, its primary benefit lies elsewhere. As highlighted by the study's author, niacin can reduce phosphorus levels by binding to this mineral in the intestine. I strongly believe that the niacin-based treatment proposed in the study could hold promise for CKD patients in the future. However, it's essential to note that the dosage administered in the study was relatively high and somewhat experimental. Therefore, I urge you to watch the video until the end and consult your doctor before considering any adjustments to your daily niacin intake. Now, let's dive into the dosage aspect in a moment. But first, a critical question: how can niacin potentially serve as the key to reversing stage 4 kidney disease? Niacin, a potent form of vitamin B3, has emerged as a boon for kidney health, according to scientific research. Numerous studies have demonstrated niacin's ability to lower elevated cholesterol levels, thereby safeguarding both heart and kidney function. A comprehensive review of these studies, published in the American Journal of Kidney Diseases, revealed that niacin exerts a favorable influence on various risk factors associated with the decline in glomerular filtration rate, GFR. These factors include HDL concentration and function, triglyceride levels, oxidative stress, inflammatory markers, endothelial function, and serum phosphorus levels. The author of this meta-analysis, featured in AJKD, suggests that niacin supplementation may significantly reduce overall mortality rates among individuals with kidney disease. The significance of niacin in the context of CKD lies in its role in phosphorus control. As we've discussed, managing phosphorus levels is paramount for kidney protection. In essence, incorporating low-dose niacin into the regimen of individuals with CKD could yield considerable benefits. While higher doses of niacin may pose potential side effects, they also present an intriguing avenue for halting or even reversing the progression of kidney disease. Now, let's address a crucial question: what dosage of niacin was utilized in this study? The recommended dosage in this study ranged from 100 to 500 milligrams of immediate-release niacin, to be taken 1 to 3 times daily. However, it's important to note that doctors typically advise undergoing periodic liver function tests when consuming 100 milligrams or more of niacin daily. If you're already taking a renal multivitamin, chances are you're receiving approximately 20 milligrams of niacin per day. As I mentioned earlier, it's essential to discuss with your doctor whether a higher dosage could be beneficial for you. Kidney disease, up to stage 5, can be reversed if you do this. Have you ever been told that your kidney disease is irreversible? What if I told you that it doesn't have to be that way? Hi everyone, welcome back to our channel. Today, we're diving into a topic that could change your life: how to reverse kidney disease, even up to stage 5. According to the National Kidney Foundation, over 37 million Americans suffer from chronic kidney disease, and many believe their only option is dialysis or a transplant. But there's hope. Studies have shown that with the right lifestyle changes and treatments, you can improve your kidney function and potentially reverse damage. Imagine reducing your creatinine levels and improving your GFR numbers without the looming threat of dialysis. By watching this video, you'll discover 6 powerful steps that have helped countless others not only stop the progression of their kidney disease but actually improve their kidney function. These steps are backed by science and real-life success stories. Stay with us until the end, because you won't want to miss these crucial insights. By the end of this video, you'll have the knowledge and tools to take control of your kidney health and see real improvement in your GFR numbers. Let's get started on this journey to better health. Let's dive into what I consider the most powerful superfood in the world for boosting your GFR. This is a favorite among vegans, as it's one of the best plant-based sources of iron. It also boasts an incredible calcium content, with over 26 times the calcium found in milk. But that's not all. This superfood is packed with essential vitamins crucial for those with kidney issues, including vitamin B1, B3, B6, as well as folic acid, vitamin C, and more. Are you intrigued yet? Step 1. Spirulina. Yes, I'm talking about spirulina. This superfood is a game changer that I always include in my diet, and I highly recommend you do the same, especially taking around 1 teaspoon before bed. Why? Let me tell you. First, spirulina can significantly lower blood sugar levels, which is a massive benefit for those with diabetes. But that's just the beginning. Spirulina is also a powerhouse when it comes to controlling blood pressure, reducing cholesterol levels, and even aiding in weight management. Numerous studies back up these incredible benefits, making spirulina nothing short of amazing. Researchers attribute spirulina's kidney-protecting magic to its potent antioxidant properties. In fact, taking just 1 to 8 grams of spirulina per day can yield significant health benefits. So, here's my tip for maximizing the benefits of this superfood: consume it in the evening or before bed. Spirulina is rich in tryptophan, an essential amino acid that helps your body produce serotonin and melatonin. Serotonin is crucial for mental health, while melatonin is the hormone that regulates sleep. By having spirulina before bed, you may enjoy better sleep, which is vital for kidney health. While spirulina is fantastic, it's important to note that it may not be suitable for those with autoimmune diseases like lupus or rheumatoid arthritis. However, for most people, the benefits of incorporating spirulina into their diet are too significant to ignore. Just be sure to choose a brand that certifies the purity of the product. And remember, spirulina is also a source of protein. For instance, half a tablespoon, about 3.5 grams, provides around 2 grams of protein. While that might not seem like much, it's essential to keep track of your daily protein intake, including what you get from spirulina. Managing protein levels is crucial for those with kidney concerns. So, are you ready to give spirulina a try and unlock its incredible benefits? Step 2. Never lose hope. Now, let's address a crucial question that I'm sure many of you are asking. Is it really possible to improve your GFR in stages 4 and 5 of CKD? The answer is a resounding yes. And this isn't just wishful thinking, it's backed by solid scientific evidence. According to a study published in the journal PLOS One, which analyzed data from 406 patients with CKD, improvement is indeed possible. The researchers found that 62 patients, 15.3%, showed a sustained improvement in their GFR over time, with an average increase of 1.88 milliliters per minute per year. Remarkably, many of these patients were in stage 5 pre-dialysis and still managed to experience very slow disease progression. So, what does this mean for you? It means there's real hope for improving your kidney health, even in the advanced stages of CKD. It means you shouldn't give up on your kidneys. Instead, you should collaborate with your doctor to find the best treatment plan for your condition. It means you should follow the steps I'm about to outline, which are based on the latest scientific breakthroughs and proven to help slow down or even reverse the progression of CKD. The aim of the study wasn't just to prove that GFR improvement is possible at any stage of CKD, including stages 4 and 5, but also to identify the factors associated with GFR improvement. So, are you ready to discover these life-changing steps? Let's dive in. Step 3. Key factors. Here's a vital question. What factors are crucial for reversing the decline of GFR? In the study we just explored, achieving a higher number of therapeutic targets was directly linked to a greater chance of stopping or reversing the decline of CKD. We need to ensure we're hitting these targets 100%. The study highlighted 5 key targets. Let's dive into what they are. First, blood pressure. It's evident that managing this is absolutely crucial. Second is proteinuria. Spoiler alert, this turns out to be the most important factor. We'll delve deeper into this later in the video. Third, the use of renin-angiotensin system blockers. Fourth, the number of complications present, anemia, hyperphosphatemia, metabolic acidosis, and hyperkalemia. Addressing these complications made a huge difference. Fifth, diabetes. Managing this is obviously very important. So, how do you achieve the targets outlined by this critical study? Stick around, and we'll break down the steps to hitting each one and improving your kidney health. Let's get started. Step 4. The targets. First things first. Keeping your blood pressure in check is non-negotiable. The experts can't emphasize this enough. Aim for a reading below 130 over 80 millimeters of mercury. It's crucial not to exceed this limit. In my videos, I often dive into natural methods to hit this target: regular exercise, watching your sodium intake, maintaining a healthy weight, and even incorporating specific natural supplements can all make a significant difference. But let's face it, not everyone can manage their blood pressure without medications, and that's perfectly okay. It's not your fault. If you need medication to control your blood pressure, that's completely acceptable, but it's vital to ensure you're using the right ones. Now, this can be a complex subject, which is why I recently dedicated an entire video to it. You can find it up here if you're eager to learn more, and also down in the description. Taking charge of diabetes control. Another critical therapeutic target is managing diabetes. According to the study, those who showed improvement were less likely to have diabetes mellitus compared to those who didn't. Unfortunately, having diabetes does make improvement less likely, but it's not impossible. In fact, among the 62 individuals who saw improvements in their GFR, 9 had diabetes. It's essential to note that diabetes can be reversed, and this is pivotal for safeguarding kidney health. But wait, there's more. There's a key point coming up that's even more critical than diabetes and high blood pressure. Don't miss it if you're serious about turning the tide on your GFR numbers. Step 5. Managing complications. Complications are the sneaky adversaries that kidney disease brings along for the ride. They're the issues that can deal a serious blow to your kidneys. Think hyperphosphatemia, metabolic acidosis, anemia, hyperkalemia, and elevated parathyroid hormone levels. Each of these complications demands attention if they're present. Here's the kicker: many doctors tend to overlook these complications, and that's a big problem. Take anemia, for instance. It's a common complication of kidney disease that can lead to fatigue and hasten the decline of your GFR. Shockingly, many patients aren't getting the treatment they need, and some aren't even being tested for it. That's why I urge you to educate yourself about anemia. If you're experiencing symptoms like fatigue, shortness of breath, headaches, or even cold hands and feet, check out my video on anemia. It's linked up here and down in the description if you missed it. Thyroid issues are another often ignored complication, just like anemia. Many people with thyroid problems don't even realize they have them. Hypothyroidism, where the thyroid doesn't produce enough hormones, is especially prevalent in those with CKD. Hyperthyroidism can cause a slew of symptoms, but they can easily be mistaken for other conditions. It's crucial to ask your doctor for a thyroid test. Treating thyroid problems could potentially lead to improvements in kidney function. Hyperphosphatemia, or too much phosphorus in the blood, is a common and dangerous complication often seen alongside metabolic acidosis. Both can be managed with the right diet. Think less meat, dairy, fish, and processed foods. Hyperkalemia, or high potassium levels, is another tricky complication. It's a bit of a hot topic because the causes aren't always straightforward. While reducing potassium intake used to be the go-to solution, we now know it's not that simple. Unmanaged diabetes, metabolic acidosis, and certain medications can all play a role. Keeping potassium levels in check is essential for preserving kidney function. If you're dealing with any of these complications, make sure you're getting tested and treated properly. Ignoring them could accelerate the decline of your GFR. Stay informed and proactive. It could make all the difference in safeguarding your kidney health. Step 6. Beat proteinuria. Number 6. This is probably the most important step in order to reverse the decline of your GFR numbers. This step is definitely one of the most important things you can do to help your kidneys. Proteinuria, also known as protein in urine or albuminuria, is the most powerful predictor of kidney function decline in all stages, which means that there is no improving if proteinuria level is not under control. And this is true for people in all stages of kidney disease. So when it comes to proteinuria, our goal should be to keep this level below 30 milligrams per gram because, as we can see here, the higher the proteinuria, the higher the chance of kidney disease progressing to a worse stage. Okay, so how do you make sure your proteinuria is not too high? There are strategies that actually work. There is a vitamin that's needed to keep proteinuria under control, there are foods that can help, and of course, there are medications that can be used. There are actually 2 new medications that doctors are just starting to prescribe and that can make a huge difference with proteinuria and consequently with CKD. I've covered more about this in my recent video. It's up here and also down in the description. And this is all for today. Thank you for watching. God bless you all.